Good morning. This is the Healthcare Committee. It's Friday, February 27th. And for the next hour or so, we're going to take up H 814 and H 816, we hope. So we're going to start off with H 814, rates and neurological rights. And our first witness is Colin Robbins. Colin, would you join us at the table, please?
Absolutely.
Thank
My pleasure. Good morning. For the record, Colin Robinson, Vermont NEA, and we're just asked to speak briefly because Vermont NEA is mentioned in the most recent draft of 814 as it relates to Artificial Intelligence Advisory Council. And obviously, artificial intelligence is something that our members are adapting and working with their students in an educational space to address and provide both literacy as well as spaces to identify opportunities and challenges. So the headline is, we are happy to appoint a member to the Artificial Intelligence Advisory Council.
Okay,
Thank you.
thank you.
Representative Chena said that was what you were looking to hear. And so if you're okay with that, and we are.
Good, thanks a lot.
We just didn't want to do, the nothing about us without us. We didn't.
Thank you very much. You did.
I hope my testimony is some of the simplest you may receive today.
After the floor.
No, I hope it's the most complex we've seen today. Sorry.
Okay, any question?
Yeah, well, the advisory council, I'm just orienting myself for a minute. So that's section 4, right?
We're adding a member from the Vermont NEA, appointed by the Vermont NEA to the task force.
Got it.
And the intent is so that we have an educator on when they look at use of AI in education.
Thank you.
Thank you, Brian. No other questions?
Thanks for being here.
Yeah, thanks for your work. Okay. Happy town meeting day.
Thank you. Okay, the next witness that we have is on Zoom, I believe. Sophia Simpkins.
Yes, thank you. So my name is Sophia Simpkins. I'm a primary care nurse and I'm the VP of Political Education for VFN HB. We represent nurses and health professionals at UVMMC. I really appreciate the opportunity to testify today. AI is entering healthcare rapidly with little input from direct care providers or more importantly from our patients. For example, UVMC is working on implementing a AI remote patient monitoring program that is relatively untested. We looked into it. It had only been used by a handful of hospitals for only a few months before they started considering implementing it. So this is relatively untested. It's a third-party company that would have a direct live feed of our patients. We don't know what they will do with this data. Will they use it? Will they maintain it and keep it to train future models? And we're talking about people at a very vulnerable point in their life. Like if they're having remote video monitoring, it's because they're confused, they're delirious, they are not able to maintain their own safety. And so a remote video feed traditionally has been monitored by a human, someone who it works directly for the hospital, not a third-party company, who then would call the nurse and say, hey, Mrs. Smith is climbing out of bed. Can you go check on her? So this is very different to have AI in a third-party company to have video feeds of our patients. And additionally, it raises questions. Who is held responsible when a patient is harmed? Because this has not been, there's not been adequate safety research to show that this is equivalent to standard practice. Is it the nurse who's at the bedside who's held accountable? Is it the hospital? Is it the third-party company? And there's been a lot of questions about that in AI in general. What happens when AI fails? So given that, it's crucial that AI in healthcare is regulated. And additionally, I would urge you to consider having an RN, a registered nurse, as representation on this advisory council. Nurses are in a unique position to advise on the risks and benefits of proposed implementation of AI. As we directly provide the patient care and are able to evaluate the risks and benefits. And I would say, like nursing, we're not healthcare professionals. We're not necessarily against all AI. There is definitely positives, like using AI to help write notes. But we really cannot just let Vermonters be guinea pigs for untested technology that shows a strong potential for violating their right to safety and privacy. So these should not be implemented without. I agree with having this advisory council to really assess the risks and benefits of the changes, and I don't want them just to be motivated by the bottom line. And I'm happy to answer any questions if you have any.
Questions?
Just a clarification. Sorry.
Go ahead.
I just wanted to have you say again what VFNHP stands for.
Of course. So the Vermont Federation of Nurses and Health Professionals.
Okay.
So this is a healthcare union for nurses and other healthcare professionals that work for UVMMC. So it's the main camp, it's the hospital and the
Okay,
surrounding satellite clinics in Burlington.
Thank you.
Susan?
So I see that there is a recommendation to add one member with experience in healthcare appointed by Vermont Medical Society. So that Vermont Medical Society is docs and PAs, which we know. I'm not seeing anything from nursing. I think your point is well taken. Thank you. That the use of AI in patient care is really a nursing function. So I'd like to consider adding a nursing member.
I appreciate that.
Thank you, Liz. Right.
So, you were saying that you have concerns about the impact of the use of artificial intelligence technology on patients' rights. And did you also, or can you say a little bit more about how it might affect the workforce in a negative way? Because we've heard how AI can be a tool that can make job work easier. And you even alluded to that when you talked about helping with medical records. But when you were talking about the video monitoring and removing humans from the equation too much, how might that also impact our workforce and our investment in human resources over time if we rely too much on AI?
Of course, yeah, that's actually, part of it, as well as the hospital is talking about eliminating. That would be more of the support staff union, which is where that role, so not necessarily part of the union that I represent, but it definitely would be eliminating labor with this use of AI. And it does affect nursing and health professional as well. Part of my role in primary care is answering my chart messages. And it's a very real possibility in the future that when you message your doctor's office, you won't be reaching a nurse, but you will be reaching an AI chatbot instead. So that's not something that's being spoken about at my hospital currently, but that's certainly a possibility for the future as nurses being replaced with AI. Way.
Thank you. So it sounds like the perspective of nursing, either on the council or in the work of that council, would help us maintain the perspective that not only is bringing the experience of patients directly in, but also the experience of a variety of workers on the ground, on the front lines, and how AI could help or not, or actually be a problem in that work. So.
Agreed. And a physician voice, though appreciated, definitely does not replace the voice of a nurse on this council.
Thank you. And I think we're going to have time for committee discussion at some point, but this really just to validate Leslie's suggestion. We've had a few other providers send in written testimony asking for a voice that there may be a benefit to considering, because I don't think we're going to do anything with this bill today. So we have time. So maybe we consider like like a working group or a subcommittee, or giving them the power to form a subcommittee of healthcare providers or some mechanism so that it's not too, like, we can add members to the council, but we could also encourage them to engage others. You know, there's ways we can make sure every voice is included, if not on the council, through the work of the council. So I do hope we have time for that. So just, I'm hearing your request, and I think we need to figure out how to make it work.
And during our committee discussion, we can.
Exactly. We can hash it out then. Yes. I'm just acknowledging I hear it from you, and I also hear Leslie saying that you think it would be important, and I agree. And I think you just have to figure out the right way. Thank you for being willing to help.
Of course, thank you for hearing my testimony.
Thank you very much for coming in on the Zoom.
Of course, I appreciate it. I hope you have a good rest of your day.
Thank you. Next witness, Stephanie Winters. Zoom too,
It's live and in person.
huh?
Zooming from the bench to the chair.
Yeah. And thank you for sending your stuff in.
Yeah, absolutely. Good
I
morning.
understand, Stephanie, you want to talk about 816 too.
I was asked to do both, so I can just roll into it if you want me to.
Yes.
Okay, perfect. So good morning. For the record, Stephanie Winters, representing the Vermont Medical Society, and more so on 816, both the Vermont Medical Society and the Vermont Psychiatric Association. I came prepared on 814 to talk about the original bill, so I don't have as much to say as, the new draft, with most of it struck out and just a council. So forgive me if I'm on the wrong version, but I thought it important to talk about the original since you hadn't passed the amended version. So I just want to begin by acknowledging the importance of what the original bill seeks to address. The rapid development of artificial intelligence and neurotechnology raises legitimate questions about privacy, autonomy, transparency, and protection from misuse. Establishing guardrails around neural data and ensuring Vermonters know what and when AI is being used in health-related communication are thoughtful and forward-looking goals, although not as forward as they used to be, because we are there. Protecting cognitive liberty, preventing exploitation of neural data, and promoting transparency in mental health technologies are important policy objectives. And Vermont has the opportunity to lead thoughtfully in this emerging area. At the same time, it's really important to consider how this bill intersects with Vermont's healthcare workforce reality. There are several practical considerations for clinical medicine that merit attention to ensure that the bill does not unintentionally disrupt routine healthcare delivery. First, clarity of scope is essential. Terms such as neural data should be carefully defined so that the routine diagnostic services such as electroencephalogram EEG, which is a non-invasive diagnostic test that records the electrical activity of the brain, interoperative neuromonitoring, and other neuropsychologic testing are not inadvertently subject to separate consent and record and data destruction frameworks beyond existing medical record laws. Clinical diagnostic data already falls under HIPAA and established professional standards. Second, data destruction provisions should be harmonized with medical record retention requirements. Healthcare practitioners are legally obligated to maintain medical records for defined periods. So any revocation-based destruction mandate should clearly exempt data maintained as part of the medical record to avoid creating conflicting legal duties. Thirdly, emergency care should be explicitly protected. So in neurologic emergencies such as seizures, stroke evaluation, or traumatic brain injury, additional procedure steps should not delay care. Fourth, with respect to artificial intelligence, it's important to distinguish between AI used as an internal clinical decision support tool and AI that independently communicates with patients. Clinician-supervised AI, such as radiology support tools, risk prediction models, or documentation assistance, should remain clearly permissible without creating ambiguity that might discourage responsible adoption. And finally, Vermont should consider the impact on rural hospitals, small practices, and academic research institutions. Layering additional regulatory requirements beyond federal privacy and research standards could unintentionally increase administrative burden and reduce innovation capacity in an already resource-constrained healthcare environment. In summary, we feel the goals of 814 are commendable, and with targeted clarifications and guardrails, particularly around definitions, record retention alignment, emergency care protections, and clinician-supervised AI. This bill could protect Vermonters' neurological and digital rights while preserving access to safe, efficient, and innovative medical care. So I thank you for listening, and I've included specific amendments again on the original bill in my written testimony. I can go through them, or I'm open to answering any questions.
Questions first.
Oh.
Good job.
It didn't really speak to the part of having someone appointed to the council.
We're happy to be appointed to the council.
And-
Yeah,
and,
absolutely.
my hope is that, you know,
Yes.
there. In reading the bill, I was reading through the American Medical Association's policies around AI. They're extensive. So doctors have done a lot of work, just like some of the other professions we've invited in around this issue. And I think there's great value in those guidelines being reviewed. And
Yeah.
I don't know if you're familiar with our amendment that we don't have ledge council to walk through, but it does basically establish rights, but doesn't go further with regulation. It bumps it all to a study. So with your presence on that council, you would have an opportunity to recommend how to do everything you just said. So I appreciate you pointing out that, you know, we may need to vet some of these policies a little bit more before we make a firm decision in terms of like specific regulation.
Yeah.
So,
Yeah, that sounds great.
okay.
So
I know we
Sorry,
don't
go
have
ahead.
much council, but and I'm looking at this, I think we're all seeing it for the first time. And it is, you know, just condensed to what you're saying is really supporting the council and a study. Is that making sense?
Well, it has an intent section, so it's putting into law our intent, because then the council has that to work with. It
Right.
establishes basic neurological rights in law, so it's saying like it's making sort of an ethical decision around these 6 rights, but it's not saying anything about how we enforce them. It's asking the council to come back with recommendations like, okay, we all agree on this, what does it mean now? And then they will tell us.
Section 2. So just, there are only 5 sections, I guess, including, effective date. So that section 2 is the rights. So it's the intent, the rights section, the advisory council,
In the study.
and the study.
Yeah, yeah.
It distills down to that, which is
Yes.
cool.
Yes.
I think that makes a lot of, it sort of makes
Yeah.
it sort of accessible for me anyway, to understand what we're talking about. And so you having voice on that council, so a lot of it is just going to come out of that. We're just going to sit back and have the council do work. And I didn't see if there's a date for a report.
It would be next session. So
Yeah.
what we're doing is we're taking a stand and we're saying we have intent to use this wisely. We're establishing some basic rights, but we are not ready to put up the guardrails. We're going to ask experts to meet and come back with recommendations for the guardrails. We don't have the time to really take all the testimony and do that. We'd be rushing. So I think that was apparent, and that's why we constructed this amendment, so that we could take a step forward without jumping off a cliff.
So what I'm noticing is that we're asking for a report on by January 15th.
Yeah.
And sometimes when we have studies, we say they shall start meeting on a date, like July 1st, by July 15th, they'll have the first meeting. And I'm wondering if that might have value to
The
give
council meets regularly.
anyway,
Yeah.
monthly.
Yeah. What we might want to do, though, to your point, is maybe the effective date is changed to on passage, so they can immediately start meeting with the
I
council and
think
not
that
wait.
has value.
That's a good point. So I should write that down.
Yeah.
Okay, why don't we have our committee discussion?
Yeah. We will.
Sorry, just.
That's a good point.
Any?
I need to write it.
Have a question?
I'm a little confused. I think we're getting awful fast here, but we got an advisory council. Who are they supposed to report to?
Agency Digital Services, I believe.
Currently, that council exists. We're just changing the membership a little. We're adding people to it. They currently report to the AI director, who reports to ADS, who reports to the governor, and they give a yearly report to the legislature, which I did submit to the record when they came in. So, and I can send it to you if you want to see their recent report. So this is council that has existed for many years. And what we are doing is expanding the membership and giving them some focus.
So we're just adding two.
I think we're adding like 3 people and giving them a mission. Yeah, or more focused mission, yeah.
I like the idea of that report. Maybe if you could send it to us and get it on our
It is on
our page.
it's on Wednesday, right?
Okay, cool.
But I can send it out to your email again.
I lost track, but like,
I'll do that now anyway.
We,
okay.
we're gonna move on. We thank you very much for 8:14.
8:16.
Yeah, go ahead.
Okay. Thank you again for the opportunity to speak on H816. Again, for the record, Stephanie Winters from the Vermont Medical Society and the Vermont Psychiatric Association. The intent of this bill is clear and very important: to ensure that artificial intelligence does not substitute for licensed mental health professionals in delivering diagnoses, treatment, or therapeutic judgment. Preserving human clinical accountability in mental health, particularly for vulnerable patients, is a widely shared goal. My comments today focus narrowly on 2 drafting provisions that may have broader operational impact than intended. First, the consent requirement for processing therapeutic communications. The bill requires patient consent when AI is used to record, transcribe, or process identifiable therapeutic communications. Recording a therapy session clearly warrants consent. However, the terms process is not defined and could be interpreted very broadly. For example, modern mental health practices use AI tools to draft clinical notes, suggest billing codes, format treatment plans, extract quality metrics, and support measurement-based care dashboards. Under a literal reading of those functions, that could constitute processing identifiable therapeutic communications. And if that interpretation prevails, clinicians may need a separate consent for routine documentation support tools beyond what HIPAA already permits for treatment, payment, and operations. The practical consequence could be increased administrative burden and reduced adoption of tools designed to reduce clinician burnout. Secondly, the prohibition on AI making therapeutic decisions or generating treatment plans. The bill prohibits AI from making therapeutic decisions and generating treatment plans. The concern here is not autonomous AI replacing mental health professionals. That is clearly outside the intent of the bill. The concern is that modern clinical systems generate drafts or provide decision support recommendations that are reviewed and approved by licensed professionals. Examples include suicide risk stratification tools, measurement-based care platforms, draft treatment plan templates, auto-populated by diagnoses, and medication interaction alerts. In each case, the clinician retains full authority and responsibility. However, H816 as written does not currently include an explicit supervised use exception, clarifying that AI-assisted outputs are permissible if reviewed and approved by a licensed professional. Without that clarification, providers may interpret, and I'm not supposed to use the word providers, healthcare professionals may interpret the language conservatively and discontinue legitimate decision support tools.
You have language suggestion?
I do, yeah. I have a page full of language suggested amendments at the end of my testimony. So I'll just finish by saying Vermont's healthcare workforce is already constrained, particularly in rural areas. And if documentation tools and decision support systems are curtailed due to ambiguity, it may result in reduced efficiency, increased administrative time, and longer wait times for patients. So thank you for your consideration, and specific amendments are in my written testimony at the end.
Good.
Thank you for
such excellent testimony and such careful read of the bill. And one of your recommendations aligns with feedback that we got from one of our national experts, actually. So
Great.
good. And thank you so much for your input.
Go ahead, Brian.
So we had, in 814 originally, there was a chatbot provision and 816 is chatbots, and then in 644 was a chatbot bill. Did you have a chance to review the other approaches and see how they all intersect, or did you just focus on the one in this bill?
I just focused on the one in this bill currently.
Any other questions?
Right?
Thank you. Thank you so much.
Mike Fisher showed up. He was supposed to come for 814.
Oh,
I don't know if we have time for him.
I don't have Mr. Fisher on the schedule for 8:14.
He was.
Did you want to testify? Want to testify for 8:14?
I think I can very brief.
He was, and then I think we took him off when he didn't show up.
Didn't show up. I was, blanking out.
No, I didn't mean that.
Doing nothing important, nothing productive,
As usual.
as usual. I feel confident that you won't, and that we won't end this testimony with a member of the committee saying, thank you for your thoughtful, careful consideration of this bill. I'm happy to sit down very briefly in front of you and say thank you for attending to these issues. This is not something that we've spent a lot of time thinking about and thinking about ways to address. But I can see that members of the committee have, and that the committee's looking at it and considering ways to make sure that the public interest continues to have a focus on this and assemble the right people to maintain a focus on it. So I think on a very high level, I just wanted to sit down this evening and say, I appreciate your attention to this and consideration of the right people to have on the committee to maintain focus.
Thank you.
Thank you.
Go ahead. I don't know if you've given thought to it yet, but have you anyone that's missing on this committee or council that you would think about?
I did notice that I don't think I can see the whole list, and I did not go
Yeah, you can Google it.
yeah. I'll
Yeah.
take a look at that.
I can tell you that that no other member of the list is a healthcare provider or related to healthcare. It's like public safety, labor, commerce, but you should look. Do you feel comfortable? Just okay, if I ask.
Yes, please. I was
Do you-
gonna ask if you wanted to lead discussion on this,
Oh.
8:14.
Are you comfortable? Are you comfortable not being on it as the advocate? Like, do you trust if anything comes up, you can go to them with it versus you being on it? Because I figured you guys can go testify to them if you're concerned. You don't have to be on the council, but if you felt like you needed to be on it, we'd add you to our list of people requesting to be on it.
I'm comfortable not being on.
Okay, thank you.
Not being named.
Okay. You're opting out.
I will just say, as someone who, first of all, I didn't know that we had an AI council.
Yeah.
But considering that AI, with healthcare is seems to be like one of the leading industries that AI is going full in on. The fact that we don't have
Exactly.
anybody
Yeah.
looking at it from a healthcare lens, frankly, is a little alarming to me. So
I had the commissioner of health and that was it. But my concern was that, and you're welcome to weigh in on this. My concern is if you look at the membership of the council, when it was created, it's almost all people appointed by the governor and they're all heads of agencies. And I think it's because the angle was how is it internally in government being used? But now we're looking at how the private and public sector intersect and how healthcare being such like a hybrid sector, how it integrated it is. And that I think it's important that we add a few people, which is why we're adding these different perspectives. And also you'll see that something we haven't discussed is it delays the repeal of the council. This council was going to cease to exist next year, but we're delaying the repeal to 2030 and asking them if that's good enough because there needs to be work done still. And we heard the AI director say that he supported that for now. So.
Usually hear from me, I usually say a line, something like, industry runs circles around the public interest and things like this. And, like how you do a multiple of circles does it run spheres around us? I mean, I have we are all figuring this thing out, and it is in our lives. I did have the thought, sort of, this is not a question for today, it's a question for tomorrow, about whether healthcare is important enough. But so it's great that there is a group that's focusing on, on AI generally, but whether it makes sense for that group to have a subgroup that's more focused particularly on its impact in healthcare. I think sort of the previous discussion about really important appropriate uses for AI and how to even support that, and at the same time put guardrails around it to prevent the more negative things.
So that being said, if the committee in our discussion decided to create some direction to them to have a working group or subcommittee as part of their work, that might achieve that goal.
Yeah.
That's something I've been thinking about actually, but I don't want to complicate it, but.
Leslie, go ahead.
Thank you. I don't know how directive we want to be, and that's worth a conversation. I mean, they may want to figure out their own process. But I'm looking at section 3 and 4, and you said that the council is going to be dissolved.
It was going to be repealed in 2027 if we didn't extend the sunset.
Is it in here?
Yes, there's,
At the end of section, in the middle of page 25.
before section 5 begins, you'll see a little thing where the repeal is extended.
May I ask if you have any knowledge of, are there any other bills that are moving around the building that have a repeal of the sunset?
Not that I'm aware of.
Okay, I didn't know.
It should be in the miscellaneous gov ops. They usually do like a miscellaneous boards and commissions bill. So if we missed it, they could always have done that next year in January, February, but it's probably good we do it now. If we're adding people and giving them a mission, that's going to take more than,
Hey,
They just did reports, but I don't think they did boards.
Thank you.
all right. So just, I have this we have this on the schedule for the Tuesday when we get back. Tuesday, March 10th in the afternoon. I have it as marked up and possible votes. Is there, because I do think we need Ledge Council to walk us through the changes that have been made, and we don't have Ledge Council today. Is there anybody that anyone feels that we have not heard of, that you're still looking for information on, that you still have questions and you're not sure, that we can work to, try to have that done the Tuesday we get back? Brian?
well, there is one person.
You don't have any.
There's one person.
Okay.
That I was looking at the list that I needed to look at my cheat sheet. So the Attorney General's office was willing to, they didn't feel like they had to, but they were invited, and they told me today if they have a chance, they would like to come in. It would be brief. So maybe that day we hear from them. And the only other group that I heard from that I think we haven't heard from is Voss. Sent me an email about, I don't want to speak for them, but I think it's safe to say, because it's public, that they were offering to have a member. A lot of people want to add members, but I think if Voss is here and we could give them a chance, but.
I think Boz is gonna be here this afternoon, and we'll ask if they'd like to either submit written testimony or if they wanna testify on this as well.
They're the only ones.
I just got a question, because, we had this bill of 27 pages and now it's down to about 5. What was the reasoning, or who made the decisions to take out all the 22 pages?
Can I answer that?
Yeah, I'm just.
Do you remember the walkthrough of the 27 pages?
Yeah.
We were all, like, our heads were spinning.
No, I know. But
There was an enormous amount of things in the original bill. And we frankly did not have time to do justice to all of those things. And so we
I have no problem with it. I just wanted to know.
we thought, hey, let's get something, acknowledgement, and the board
No problem.
or council, and
And I can't remember exactly how it happened, but I know me and Alyssa talked and Daisy talked and we were like, this is too much to do right now. What's possible? And I think I offered, I said, let me try to create an amendment, and then I wrote something, gave it to Jen.
And if you remember that there was a piece in this bill originally that it didn't mirror, but it sort of dealt with the same issues of 8-16, the other one. And I think that when we originally conceived of this, we thought we would weave them together with these two pieces, but it seemed like we were moving right along with it. And so that's why we're doing the two bills separately now. Okay, all right, I want to discuss also, so, I mean, I'm fine going into lunch if anybody else is fine
I'm
going
fine for
into
a
lunch.
minute.
I just want to catch you up on something. We had a conversation while you were out of the room about maybe changing it to on passage. So rather than July 1st, so that the council could get started since the council already exists. You can start this work. So just so you know that.
We'll have Brian work with Ledge Council.
Yeah, I took a bunch of notes, and what I was gonna do is talk with Alyssa after and just make sure you're okay with my suggestions to Jen, and then Jen would come in with like a choose your own adventure where it's like, here's what we have, and we can add these things or leave them. You know how she does that, where she has like yellow and we have, so she'll give us, my hope is she'll give the committee choices, so it's efficient.
And we have all Tuesday afternoon. That's the
And
only
that-
thing that we have on our schedule.
So we should be able to
So
get
we'll
it.
talk a lot. Okay.
8-16,
So 8-16, I'm very sorry, everybody. I just haven't been here, so I haven't had it. I don't know what discussion you had today around 8-16, other than Stephanie.
Well, you were off representing us in Washington DC this week. We heard from Kelsey Stasseth from NKHS. We heard from Stephanie Winters. We heard from Jeremy Adderman from the National Council for Mental Wellbeing, who works with providers that use these tools all over the US. And I'm curious if the committee, I've been talking individually with committee members about who else they might want to hear from. But like with the other bills that I have in play, we've tried to keep this kind of narrow, not expand it to chatbots, intentionally to manage our time well and do diligence for the complexity of all the issues. Brian looks confused.
well, you said not do chatbots, I'm confused.
Yeah, chatbots are not in 8-16, but this, I've been talking with members in the Senate who will make space to do testimony and stuff on chatbots.
Oh, I thought they were.
So we're sort of sending them.
Yep, they said if we send them this piece that takes care of the clinical tools and protects patients and providers, and the tools really, that they will take up the chatbot side of it, which is more the public use of chatbots, because we do not have time this week to take, I think, what we need to wrap our brains around that topic as well.
Yeah.
You're welcome.
So it's because it doesn't explicit, I'm sorry.
No. I just wanted to say also that I don't know if there's been discussion or not, but maybe if we can work with Vermont Medical Society, who's suggested language on the other, because I do recall that as we were walking through the bill, I was thinking, gosh, I mean, I know how medical records are actually generated and.
So, yeah, their comments, I have like three more changes to the bill. We haven't had Ledge Council, so they haven't been made. So we'll need to do, when we come back, another walkthrough with the changes that we've heard recommended, which are all, I think, very good changes that align with the intent of the bill as we've discussed it.
Okay, Brian and then Leslie.
I know that it doesn't explicitly name chatbots, but it does say that a person, corporation, or other entity shall not offer, provide, or advertise mental health services that represent artificial intelligence as providing therapeutic judgment, diagnosis, treatment, or therapeutic communication, and a chatbot falls under that. So, you know what I mean? So even though it doesn't name chatbots, a chatbot is that. So that's why I view this as like, that's why I was like, okay, we're going to address chatbots in this. So we may not solve the problem in this, but I think we at least need to hear from the people who are concerned about chatbots a little bit. And if we don't resolve it here, we don't resolve it here. And I know that the VPA, the Vermont Psychology Association, and the National Association of Social Workers have both reached out to me about the chatbot, the mental health provision of mental health services using AI piece. And if you look at the letter we got for 814, it does also say 816. They took the Vermont Psychological Association talks about creating a 3-tiered system. I don't think we're going to work that out today. I feel like the council needs to work that out through the work of 814. But in their 3-tiered system, they talk about administration, human reviewed delivery, and automatic delivery. And so what that would mean is like administration would be like the notes stuff where like it's being used behind the scenes and humans are reviewing it. It's not doing its own thing. But the second part tier they're talking about is like when you use it as a tool with you, but the third part is the chatbot. It's when it's doing it on its own. And so like, I guess what I'm saying is hearing from them a little bit about this.
So Brian, there's, that keeps it germane so that they can take all that testimony in Senate Health and Welfare.
What
And
page you want, Brian?
additionally, I think this
4.
speaks to the tools, and Stephanie gave us a recommendation to put definitions in for things like processing and treatment and further definitions that I think intend to speak to that.
Can I, please, on Tuesday or Wednesday morning, I believe after, because I don't think we have ledge council the later half of Wednesday morning, correct? And we have nothing there. Could we schedule, can we work with, Tasha? And can we schedule just one
You want to hear about
person
chatbots?
to hear about it? And the only reason I'm saying that is because, yes, there is enough language to make it germane. And we want the Senate to be able to have that. But let's not forget how quickly things move the last week
It's true.
sometimes of the session, where if it comes over to us, we may not have, I'd like to introduce the topic.
Yeah,
So that-
Kelsey talked a little bit about
Yeah,
it.
yeah.
If we remember back to
Yeah.
Kelsey's
I
staff.
just, I'd like to do, because if it comes back from us, we may be moving really, really quickly
Yeah.
and not have time to line that up. So
I
we
al-
have some time. So let's just do
Yeah.
Yeah.
I also want to note that NASW, who is interested in the chatbot topic, was invited to offer language to this bill weeks ago. So I'm restating that they had the opportunity to advance that topic in here and
yeah. And I'm not saying we're going to change anything in it. I just want to introduce the topics for if it comes back to us with.
so we've done that.
Amended.
Yeah, I don't know if they would agree with that. So I think we need to, and I don't want to speak for them, but they're saying I've been approached by their lobbyist and by the director, them feeling like they're being left out of the discussion on chatbots. And even on when 814 came, when the director of the NASW started to talk about chatbots, Topper was ready to redirect her because she was told not to talk about chatbots. So she didn't have her chance. So I feel like they need a chance to at least
That's what
present
I'm
it.
saying.
Yeah,
And
that's
I
all.
absolutely do
Yeah.
not want to shut anybody out and I want to hear on this. I'm trying to weave it in with the things that might be moving back and forth.
Okay,
Okay.
I feel heard. Thank you.
So is everybody, so just to let you know that we are planned Wednesday afternoon to come back to,
585.
no, that's in the morning. Wednesday afternoon, because we have Katie, we're coming back to 816 and 817. Those are both of her bills, and that's the only time we have her.
Yeah.
So
1 to 2:30.
the intent is that we will have both these bills marked up. And.
This is the agenda that we can.
Oh, thanks. Rather than my scrawling on it. Yeah, yours is even worse. So, yeah, my intention is that we can do markup and possible votes on both 816 and 17 because we have Katie for a limited amount of time. And Then, and we're gonna do a little bit because we have Jen in the morning on 585.
Yeah.
And I'm gonna tell you what my intention is, so you can be thinking about
Yeah,
it. I
please.
know that you're gonna like be thinking about this all town meeting break.
Can we finish on 8:16? I just had a question about that. I'm not sure.
16?
You're moving beyond that?
Oh, I'm sorry. What was the question?
I appreciated that you brought up Kelsey's name because in my notes, there were two questions and I just wanted to get it on the list to make sure I might misunderstanding. He was talking about a definition of augmented intelligence, and that needed to be included. I don't know. if
That is
you
true.
Agree with that or not, but he did bring it up. And the other thing that he brought up, and it left with a confusion for me, is he said there's a conflict within the draft. Internal conflict within the draft. I did not understand that.
I've got it.
Okay, that's all I cared about. Thank you.
Okay.
Thanks.
Thank
Leslie.
you, Leslie. So 585, I want you all to be thinking about, my intention is there's a lot of sections in this bill. And there's a lot of great stuff in it.
Terrific stuff.
He's biased.
Is this 585?
Yeah, it is my intention on Wednesday morning that I'm actually gonna straw poll each and every section.
Oh, that would be
That's a
good.
good idea. Good idea.
That's oftentimes what we will do. I want to get, because I want to make sure, I want to get the committee,
Understanding each side.
I want them to understand each section. And they are, the various sections are very different. I want to make sure that everybody understands each section, and I think it's an important bill on many, many levels, and I really want the support of the committee on this bill. So I'm intending to straw poll each and every section of the bill.
When is this gonna happen?
Wednesday morning.
So
And you're talking about 1.2,
Yes.
draft 1.2, yeah.
can I just repeat what I heard to make sure I understood? That Tuesday afternoon is gonna be AI, Wednesday morning is 585?
Right.
Wednesday morning is 5:85.
Thank you. Okay, I just wanna make sure I'm getting it in my head right.
But then also Wednesday morning, we're going to do a little
Chat.
chat bot.
The 816
Testimony.
chatbot.
Yep.
Okay.
Why don't you get someone that you want to hear from?
You said that you've been approached.
I would say
by-
Rick Barnett and the NASW are the two I would request.
Let's work with them.
Whoever they choose, like from those groups.
Okay, that brings us to, I think
Just they-
first of all, we can go off of live because that's about as far as we've got.